Nicotine replacement products available at UHN and how to administer them. In this video, you will learn about the different nicotine replacement products available at UHN and how to administer them. These include Nicotine Patch, Nicotine Gum, Nicotine Inhaler. Nicotine Patch. Follow these steps to use the nicotine patch. Step 1. Apply the nicotine patch to an intact, clean, smooth, hairless area of the body, typically the upper arm or back. Depending on how many cigarettes a patient smokes per day, they may need to wear more than one patch at a time. Step 2. The nicotine patch is applied to the skin for 12 to 24 hours. During the time that it is applied, it releases nicotine into the bloodstream to help prevent nicotine cravings from occurring. Step 3. Old patch or patches should be removed before administering a new patch. The patch can be used on its own, but works better when it is used in addition to the gum or nicotine inhaler. Nicotine Gum. Nicotine gum is used when needed to treat withdrawal symptoms, including cravings for cigarettes. Depending on how many cigarettes a patient smokes each day, they may be prescribed a 2 mg or 4 mg gum. Avoid using the nicotine gum in patients who have severe gum disease or temporomandibular joint disease. Follow these steps to use the nicotine gum. Step 1. Instruct the patient to put a piece of gum in their mouth and bite down on it twice using their back teeth. Step 2. Instruct the patient to use their tongue to push the gum against the inside of their cheek. Step 3. Instruct the patient to hold the gum against their cheek for approximately 30 seconds. The patient will feel a tingling or peppery feeling in their cheek. This is the nicotine being released from the gum. Step 4. After approximately 30 seconds, instruct the patient to move the gum from their cheek and bite down on it twice again. Then return it to the inside of their cheek for 30 seconds. This can be alternated between the left and right cheek. Step 5. Repeat steps 1 to 4 for approximately 30 minutes to release all of the nicotine from the gum. Patients should be cautioned to avoid drinking any acidic beverages, such as juice or soda, for 15 minutes after chewing nicotine gum, as it can decrease absorption of nicotine gum, making it less effective. Nicotine Inhaler. The nicotine inhaler is used when needed to treat withdrawal symptoms, including cravings for cigarettes. Avoid use of the inhaler in patients who have reactive airway disease. Follow the steps to teach patients how to use the nicotine inhaler. Loading the inhaler. Step 1. Remove the reusable plastic inhaler from the wrapper. Step 2. Open the inhaler. Twist each end until the arrows on the middle of the inhaler are pointing towards each other. Then pull gently to separate them. Step 3. Remove a nicotine cartridge from the package. Step 4. Place the cartridge in the hole at the end of the longer half of the 2 inhaler parts. It does not matter which end of the cartridge goes into the inhaler. Step 5. Attach the shorter part of the inhaler, similar to how you would put a cap on a pen or marker. Step 6. Twist the ends of the inhaler so that the arrows are no longer lined up to lock the inhaler. Using the inhaler. Step 7. Instruct the patient to hold the inhaler between their fingers, like a cigarette, with the thinner end of the inhaler pointing towards them. Step 8. Instruct the patient to place the tip of the inhaler with the nicotine cartridge in their mouth. Step 9. Instruct the patient to inhale and hold the inhaled air in their cheeks for 5 to 10 seconds. It is important to note that patients should not inhale the contents of the inhaler into their lungs, as the nicotine is absorbed into the bloodstream to the buccal mucosa, the blood vessels on the inside of the cheeks. Step 10. Instruct the patient to breathe out. Each inhaler contains sufficient nicotine for approximately 20 minutes of continuous puffing. For more information about how to dose nicotine replacement therapy products, please refer to the UHN nicotine replacement dosing algorithm. For patient-specific information about managing nicotine replacement and the use of nicotine replacement products, please refer to the pamphlet Treating Nicotine Withdrawal in the Hospital, available on the Patient Education section of the UHN intranet. In this video you learned about the different nicotine replacement products available at UHN and how to use them. These included Nicotine Patch, Nicotine Gum, Nicotine Inhaler.